I'm Dr. Margaret Lafferty, live from the 2017 Hot Topics for Neonatology meeting here in Washington, D.C. I'm joined by Dr. Walter Kraft, and we're here to talk about his discussion for new approaches for NAS. Welcome, Dr. Kraft.
Thank you.
Thank you for being here. What would you say is the main objective of your talk?
I think what we're looking at would be new topics around neonatal abstinence syndrome, but I think probably the focus would mostly be around pharmacologic therapy, because that oftentimes would be the main focus in terms of what's the best tool when we do have to use drugs in terms of which particular drug.
Great. And I know you were quite involved with the Beborn study. If we could talk about that and the design of that study.
Sure. So this is examining the differences between buprenorphine and morphine for the treatment of neonatal abstinence syndrome. As you know, buprenorphine is a partial mu agonist used quite a bit in adult abstinence, has advantages as a safety because of that partial agonism in terms of respiratory depression. So the design was double-blind, double-dummy, single-site, in which we enrolled 63 infants randomized to the standard morphine regimen or buprenorphine.
And that was at Jefferson Hospital,
That was
correct?
Thomas Jefferson University
That's
Hospital.
Right. And what were your major findings?
So the primary endpoint was length of treatment. And we found that compared to morphine, we had a 42% reduction in the length of stay. So 15 days, length of treatment, 15 days with buprenorphine, 28 with the standard morphine, with no safety issues identified, nor changes in the need for secondary treatment with phenobarbital.
That's great. In your opinion, what do you think these findings will do as far as initiating change in NICUs across the country?
Well, I think we're all a little bit suspicious of changing practice on the basis of a single trial. I will say that the effect size that we saw was in line with what our unblinded phase 1 trials, and I think more importantly, the work of Dr. Hall and the group in Cincinnati, who've been using buprenorphine in a retrospective fashion, in a treatment fashion, have demonstrated in over 200 infants, publication just about a month or so ago, showing a reduction in the length of stay compared to morphine and methadone, both in a more heterogeneous group of about closer to about 30%. So we see both in a randomized control trial and in a retrospective an effect size that is generally pretty similar. I think this lends external validity to the fact that this may be a better choice for treatment of NAS.
And would that be your overall conclusion from the study?
Yes.
And based on this study, where do you think what are the next steps? Where do we go from here?
Sure. So again, I think we've had a limited number of sites. The formulation is in ethanol, which concerns some people, though we've done some work showing that neonates have a larger clearance compared to adults and older children. But I think the next step is wider spread use, continuation of collection of data. I think it's easier these days with larger electronic systems.
That's great, thank you. If there's one thing you want the audience to take away from your overall talk, what would you say that is?
So I think that so I focus as a pharmacologist on what's the best drug, but if we step back and think about therapeutics, what's the best approach? And the best approach is that it's multidisciplinary, that there's a standardized protocol, that if there's an assessment, everyone is taught and it's reassessed, and that you have a continuous program of assessing your progress, identifying needs, choosing the best drug, but that's just one of the many axes that we really need to focus on to optimize care for these infants.
Fantastic. Thank you very much, Dr. Kraft. That's a wrap for us here at the 2017 Hot Topics for Neonatology Conference in Washington, D.C.